Hello colleagues, today we will be discussing about right bundle branch block. So it is one of the bundle branch blocks that can be seen in clinical practice. Previously we discussed about the left bundle branch block. Today we will be discussing about the right bundle branch block. So this is an ECG of one of the patients having right bundle branch block. First of all, we will like to see the width of the QRS complexes because whenever there is a bundle branch block, the QRS width has to increase. So it has to go more above 120 milliseconds. In this case, we can see that the QRS width is more than 3 small squares, which is 120 milliseconds. So this is definitely a broad QRS complexes. And now there are some other features on the ECG which needs to be looked out along with these broad QRS complexes, and we will discuss them further now. So what is the pathophysiology of the right bundle branch block? For that we need to know how the normal conduction system works. So let's start from here. So sinus node fires, the conduction goes down into the atria and then comes down to the AV node. From here it goes down to the his and then it divides into two branches, the right bundle and the left bundle. Well, normally the conduction goes through these bundle branch at the same time, and that's why we see the narrow QRS complexes. In the case of a right bundle branch block, this area has to get blocked and the conduction from the AV node and the his goes predominantly to the left bundle over here, and then it comes to the right bundle over here. So we'll discuss this further as well. So this is kind of a delay in the conduction. Because of that, one bundle branch conducts faster and the other conduction is going slower through the other bundle branch. Now let's discuss what happens because of this delayed conduction on the ECG. For that, we should know about the chest leads. In the case of right bundle branch block, we see a pattern which is called an RSR pattern. And this RSR pattern is also called the M pattern. And this is pathognomic for the right bundle branch block. So whenever there is a right bundle branch block, we always try to see this pattern. Now let's discuss this pattern in detail. For discussing this changes on the ECG and the pattern we see, we need to know the leads placement. So here we can see that the V1 is placed anteriorly of the chest and it represents the area of the right ventricle, and V6 is placed laterally. So whenever there is an RSR prime pattern in the lead V1, this happens because of the conduction delay at some areas. First of all, we can see with this color coding that the initial septum is normally depolarized. So this conduction, when it goes down the AV node, it goes towards the chest lead V1 or C1, and that's why we see the positive deflection. Moving on, now since this area is blocked and the conduction cannot go in this area up front or at the same time along with this left bundle, so what happens is that the left bundle depolarizes early. Now we can see that the V1 is placed over here and the conduction is going away from this V1, and that's why we can see over here marked by the green line the negativity in this ECG. Later on, what happens is that the conduction, when it depolarizes this area, then the right bundle starts get depolarizing from here. So that produces another wave, and this is again positive because the conduction is moving towards the chest lead V1, and this is more positive as compared to this one. Here we can see it is less positive, it is more positive. The reason is this is a smaller area that got depolarized, but this area is larger enough, and because of the delay in conduction, The second peak or R prime occurs because of this delayed depolarization of the right bundle, and that's why we see this classical M pattern. What else we can see on the ECG is the S wave duration. Now, because the depolarization is delayed, and as a result of that, the repolarization is also affected. So the S wave duration has to increase to more than 40 milliseconds in the leads V6 and lead 1. So this means the lateral chest leads. So this is the lead 1 and this is the lead V6 marked here by C6. So we can see this delayed upstroke of the S wave coming back to the baselines. You can see very clearly there is a delayed upstroke of the S. So whenever this is more than one small box or 40 millisecond, then this is because of the right bundle branch block, and this is again a feature of right bundle branch block. And here we have marked this conduction as well for you. Another thing that needs to be noticed is the inversion of the T waves. Now, whenever there is a right bundle branch block, we can see these inverted T waves. So we shall not get confused this with ischemia or something else. So this has to do with this issues with the depolarization. So there we can see a downsloping ST segment and inverted T waves over here in these leads, and in the lateral leads we can see the positive T waves because this is opposite to the depolarization. So these are again some of the common findings which we need to see whenever encountering a right bundle branch block.